All right, guys, it's Sunday night, and here we are again. Oh, my goodness. Dani Williamson, Integrative Family Medicine. It's Sunday evening at 7, so we know it's Sunday night service. The second you get logged on, hit your heart buttons, hit your like buttons, share it with your friends, all those things. I'm here with Victoria Bailey and Jill Dufresne, and we are doing live lymphatic assisted therapy tonight. Assisted lymphatic therapy tonight. Yeah. Oh, it's going to be amazing. And so I'm excited. Here's a Sunday night service. Cheers to Sunday night service. And we are going to be talking about lymphatic drainage. Talk to us about it.
Lymphatic system.
And the lymphatic system and all the, that's perfect. All the things involved with that and the reasons we would have lymphatic therapy. I'm really excited about this. I am. And you guys, I know 2 weeks ago you loved Victoria Bailey's breast thermography that we did live. That was fun.
That was fun.
So here we are back again. Yeah. But while you're getting logged on, I want you to know that this Friday night, coming up in 5 days, is the final Hashimoto's meeting of the year. It is our Christmas party, a big potluck. Victoria's going to be there. Jill, you're welcome to come too to answer questions. We're going to have some more surprises there as well. And the Spinach Tiger is our guest. So we're all going to be bringing a Spinach Tiger gluten-free, dairy-free recipe.
Okay.
And it's a big potluck. And it's, like I said, it's the last one of the year, and we'll be planning 2020. Hard to believe.
I know.
If you have Hashimoto's or you have a friend who has Hashimoto's, get them to the meeting. It's a ton of fun. We've done this meeting for almost 9 years, I guess about 9 years. So that's this Friday night, 6:30 at the office, but RSVP under events. So we know how much to prepare for. This Saturday will be open. Supplement stores open 9 to 1. Jackson and I have a ball in there. We had a ton of fun yesterday. November the 22nd is a Friday. That is the last 6 Steps to Healing class at the office. So it's Dani's 6 Steps to Healing. We teach it once a month. I personally am teaching that class this time. I normally don't. Allie teaches it, but I've commandeered it. I'm going to teach it. So show up. Sign up online. There's a link online. Just sign up on our website under classes. And then November 23rd is the last CBD. Well, maybe not. I may do one in December. It's a CBD workshop, and it's $10. You pay at the door, and it is a ton of fun. Tons of great information on the history of cannabis. So that being said, you guys should be logged on now. And I keep looking down. Sorry, I'm afraid Ella, you're doing a fabulous job videoing over here. All right, we are getting ready to get started on assisted lymphatic drainage. I say it wrong all the time. It's ALT. ALT.
Assisted lymphatic
therapy, not drainage. Wow. Okay.
Because
all right.
It is truly a therapy. It's not just a drain. We're actually, because we're getting the whole body. We're getting all the organs. We're getting the lymphatic system. So it's not just a lymphatic drain.
Wow. I can't wait. As you have questions, type your questions in. We'll see if Ella can answer that. Or I mean, she's not going to answer them. She'll read them off for us. But as a rule, normally, it's not this bright in here.
Yes,
right? Explain what would normally be happening here.
Very soothing. So you're welcome in here. You're nice and warm on this biomat. And it is very dimly lit, and we don't have the bright fluorescent light. And a lot like a massage, we keep you covered, left, right, and the breast area is covered with a scarf. And it's just very relaxing. We use a little bit of essential oil to relax. It's a nice reprieve from a busy day.
I've never had lymphatic therapy. Never. I have no idea what's about to happen. They're going to explain all this to you. Who needs it? I think everybody, most likely. Why you would need it, all the things. And I'm going to lay here. We're going to do this in about 30 minutes or so, right? Is that right?
Yeah.
So, right. Yeah. But normally, so talk to them. I'm going to lay down and get ready here while Victoria's going to share a little bit, maybe.
Okay, so
Unlock you.
Yeah.
So you're knotted up. Okay, so Jill is preparing Dani, which means just basically getting her relaxed.
She's done.
Which, as we know, stopping Dani for 5 minutes is a feat in itself. So this is very good. So what we're about to start is the assisted lymphatic therapy. So what people don't realize is how important the lymphatic system is. It is actually 85% of your immune system, and you don't even realize it. So this immune system, this lymphatic fluid begins to get clogged over time with any injury, stress, illness, basically time. So I like to explain what we're doing is kind of like, I liken it to changing the oil in the car. If you don't change the oil in the car, it starts to get black because it's accumulating pollutants. We're accumulating things in our lymphatics, in our immune system. Then it starts to get thick, and then the engine starts not running very well. And then finally, when it's thick and it doesn't move anymore, the engine stops running. Well, that's your immune system.
Yeah, that's when they come see me.
That's when they come see
That's
Dani.
right.
That's right.
Exactly, right?
We start to have all kinds of autoimmune disorders. Your thyroid goes out, lupus, fibromyalgia, all of any autoimmune issue
Right.
will come from that clogged lymphatic system. So we're gonna get started. We're gonna go ahead.
Oh, I'm
let's get
excited.
started.
Yeah, and you know, I would just add, when you were doing the thermography, you had mentioned how important it is for, you know, just get out and move.
Yes, yes.
And so we look at the lymphatic system, right? How were we created? Why should we be doing this? If we're, you know, created and our lymphatic system is working, well, a number of things are happening. But if we're not moving, you know, if we're not moving, we're not moving this lymph through our body. So if you were to quickly just, because the lymphatic system is so understudied, if you were to think about the blood being pumped by a heart, and it's circulatory, and so you've got that nice big pump. The lymphatic system does not have that. Human body relies on about 500 or 600 little pumps through the whole body to move lymph. And so it requires your movement. So simply what I'm doing is assisting the body in moving that lymph, all connected throughout the whole body, and uncongesting areas that you saw too on the thermography.
Okay.
Well,
my friend Derek Myers, who's a chiropractor, and we all know Derek and love
we
Derek,
do.
his whole big thing is when you stop moving, you stop moving. So
Correct.
that even means the lymphatic system. I mean, you know, you stop pooping, your body stops moving, everything. When you stop moving, you stop moving. I mean, movement is so important, whether you're moving your bowels, your body,
that's right.
your lymphatic system.
Yes, yeah. And, you know, things cause congestion from lack of movement to just the number of things. I mean, we know in the health field how we are trying to do a number of things that we need to do to keep us healthy. But if you're taking, you know, eating organic, eating clean, vitamins and all that, and you're not addressing the lymphatic system, you're missing that effectiveness. The lymphatic system actually helps nutrients, micronutrients get into your cells. It's just
So as I just
amazing.
finished my detox,
Yeah.
and like 30 plus of you all have done it as well, we should have been doing this while we're detoxing. And those of you that are
Exactly.
still detoxing, it's not too late.
No, it's not
Oh,
too
no,
late.
yeah.
And you want to do it after also. You
Okay.
want to be able to keep that everything that you've started in process. This will actually help it, and it'll go even faster. So your detox will be much more effective.
Wow.
So it's
Okay.
Yeah. So it helps everything flow. It helps get those T cells moving and make that detox real effective. So I will begin.
Guys, if you've had lymphatic work before, share that up there.
Yeah. So a couple of I'm sorry.
No.
What were you gonna say?
Nothing. I don't know.
A couple of little facts that people don't usually know is that the lymphatic system is very passive. It does not move on its own. We actually have to tickle it or move it. We have to convince it to move. It also only flows south. It only flows in one direction in your body.
What?
And so
I'm
that's
learning so much.
yeah, that's one of the reasons that we flush it and we go opposite. And because you want your you kind of want to shake it up like oil and vinegar. Is that a
Yeah.
good
Oh, we're
description?
going north, basically. We're not going south.
And I think
On this.
I think it's important, and this may not be the right setting for all the like for the technical, but your lymphatic system is very complicated. It's sectional. It's split down the middle. So everything on the right side is done on the left side, and then there are watersheds. Your body has watersheds where it doesn't flow past one or another normally. So it has its own little route. And this is just a nice fragrance. This is called Balance. And sometimes we just,
use a little.
always start with this. There's some fresh spruce in it. And we always tell our clients, just relax. Nothing to do, nowhere to go. So it is a very, very relaxing time.
We're also doing the lymphatic on the biomat. So we know that also helps too. It's a cell rejuvenator, so we know that we're moving mitochondria and other things while we're doing this. So you kind of get a little bit of a double whammy when we're doing the lymphatics on the biomat.
Yeah. And so these are the devices that are used, and we'll begin, and they'll lay gently. And the sensation you feel is just a little bit of vibration. What do you feel, Dani?
Yeah, just a little bit of vibration. That's
Yeah.
it.
So,
And yeah, explain this about the device and what it's called and.
this is called an XP Pro. It's a lymphatic device. It's been developing for over 30 years, over 100 years ago with the very first technology in Australia. But our system that we use was developed through biologists and doctors, and it uses inert gases combined with frequency and sound and vibration. And those actually work in conjunction through a microcurrent. It's high voltage, low frequency. Low voltage, high frequency, mixed with the ultraviolet
That's
light.
what happened to my hair, guys. It's high voltage. Yeah, it was set a little too high.
So when I mentioned 500 or 600 little nodes throughout the body, that is true. More importantly, we have like 3 regional areas of those nodes, and that is where a lot of the drainage and the filtration and all of that happens. And those would be here in the clavicle area, under the arms, the axillary nodes, and in the bikini line, they're called inguinal nodes. And so that is where primarily I'll be stimulating the lymph over the skin with the wands, and then sweeping that, helping the body assist to sweep the lymph where it goes in one direction.
Tiffany asks if whole body vibration is helpful.
Yes, very helpful for the body. The vibe plates
The
that are out
vibration
now.
plates.
Yes, very helpful, as well as rebounding.
We have a rebounder in my office.
Yeah, and
Yes.
if you don't, because a lot of people
I'm gonna
don't
step over
have
here.
mini trampolines is what we're talking about, a rebounder. Sometimes people don't know what that means. You can actually use an exercise ball,
Put this up over
and
your
you
head
can
there,
sit
wherever it's
right.
comfortable.
You can sit in front of the TV, and you can kind of bounce up and down on the exercise ball, and get the same thing as if you were jumping on a trampoline.
Really? I sit on an exercise ball all day. That is my chair at the office, is an exercise ball.
So bounce around a little bit.
Well,
good.
I do a lot. Okay. I had no idea that I was.
I always like to use the visual on that in a lymph vessel. If you have a couple different analogies, one direction of cars flowing down, and there's an accident happening, and then another, you have a backup of congestion, and nothing is able to flow through there, so you have congestion in those areas. Yeah. Okay, so I'm opening up the thoracic duct over here, because when the body comes together and the lymph flows, it eventually is going to come all together back in the thoracic duct and then the vena cava and through the heart. So
do you
this
know
area
what?
was real important.
That you don't know. I had thoracic outlet syndrome. My top left rib is gone because I had too small of a opening there. Everything was backed up.
Wow. We didn't know
Interesting.
that. Yeah. We learned a little bit. So what you didn't see on the camera either too is opening up the clavicle area over here and then working in the thoracic.
Wow.
When you move lymph, you move it through the whole body, and since it ends up in this area, this is around the thoracic valve, and then this opens up peristernal. And these are moves or different things that I do that will help the lymph move, and these areas will be open when the lymph is stimulated in that direction.
Yeah, I can feel the vibration. It's an interesting feel.
Yeah. How do you feel overall? That very relaxing.
Yeah.
Yeah. I have some of our clients compare this to a hot stone massage.
I've never had one.
But with glass
I
wands.
wish.
Yeah. So this is very, very important, like we mentioned, for those detoxing. So I want you to feel something. If you can see on the camera, the beauty of this device is that you can actually feel where the body is what we call sticky.
Oh.
So
It's our
you feel-
technical term.
It's a little bit of a medical term for the viscosity of the lymph. So sticky is a good way to describe that. Dani, can I ask you, did you feel a little bit of that wand dragging in this area when I first started? It's moving now, but I'll ask you on the other side. Too,
ask me on the other side, because I wasn't paying attention. I was listening to you, so I'm thinking, okay.
And
so it'll drag a little bit where you're stuck.
And a common area too, obviously in a lot of women and men as well in different areas, but common underneath the breast area is very congested, as you saw in the thermography, and this can help move that. Another is inside the elbow, and essentially what we're doing with this is, you can see the ultraviolet light maybe. I'm not sure if you can pick it up with the bright lights in here. So this will work to actually break up proteins and viruses. Your lymph is 94% water in your body. It is your inner ocean. So that gives a whole new meaning to hydrate, right? We tell our clients it's not just about drinking water. This is your lymph system, right? So you want to stay nice and hydrated.
What about people who have lymphedema? So they've had breast cancer. I mean, same thing, correct? I mean, and there's no reversing that, correct? Isn't that right?
There is no reversing.
Yeah.
Now, good news is, as time has gone on, we've done less and less radical lymphectomies.
Yes.
I know stories of, pulling all of the lymph nodes out underneath the, the
Yes.
axillary nodes. So we're not quite as radical with those anymore, and we're leaving that detox system in place. So that is great.
So having that lack of lymph node there is what causes...
Which causes the swelling,
Oh.
yes. So you've seen,
yes, and they have the
lymphedema
sleeves
and
on. Yes, yes.
So so I am a level 2 certified therapist, and we work with the Lymphedema Society, the After Breast Cancer groups.
Oh, really?
Yeah.
Valerie Maples says, I recall hearing that this helps with lymphedema. She says her mother is 83 and has had it, and is asking, is there any health or age constraints on it?
There are not. There are not. And I have a beautiful, thank you. We're going to do the same on the other side here. Beautiful little 5-year-old clients. And 14 and up to 86. 86 was my old. Have you any older clients than that? So
we have some incredible success stories.
Yeah.
Two in particular. One of them was about a young man who was about 34 years old, and he came to us and he had a knee replacement, and for a year and a half, his knee continued to drain. It was terrible. It would just drain and drain and drain, and the doctors were going to amputate it. He was actually here from another state, Minnesota, and he was going to have his knee amputated above the knee, do an amputation.
Wow.
And as soon as I started to do some lymphatics with him, and I looked at his knee, and I actually asked him to unwrap it so I could see it. It was clearly lymphatic fluid that I was seeing, and that's what had been draining, filling and draining for over a year. And doctors did not know what to do with it.
Wow.
And we did the treatment on him. He started off coming to see me 3 times a week, and then we got him down. We kind of titrated him down to where he was coming about once a week. But by the time that he left to go home, his knee was normal size. It was no longer draining. His doctor said that they had no idea what the protocol was that we were doing, but keep doing it. And so as he went home to Minnesota, and I was able to find him somewhere in, I think, North Dakota that was pretty close to him to continue with his therapy. So that was pretty amazing. And again, he was 34, and they were going to amputate that leg.
Oh, my goodness.
Amazing.
Yeah. Beautiful stories. And this actually would be a great camera view if you're fine with it. You're completely covered, which
I'm fine.
I keep you covered.
I can't see, but yeah.
You could come around this other side, maybe behind me. So an area of congestion underneath the breast area, what I do is I do like nice 14 sweeps under here, and what I'm doing as we were talking is opening up the axillary nodes in the armpit. There's approximately 25 of them.
Wow.
There's quite a few. So this kind of opens them up, stimulates them. Feels comfortable though, right, Dani?
Oh, yeah.
Yeah.
Feels good.
Yeah.
Can you feel it draining, Dani?
Well, no, not yet. What am I supposed to feel?
You know,
I'm always jealous when people say they can feel it because I can't feel it either.
Okay.
But a lot of people say that they can feel like some tingling where it actually feels like something's moving. I have people who say it feels like strings. What have you heard?
Yeah. You can feel the whole lymphatic system move together. It's
Well,
really
maybe
neat.
if we
Yeah.
weren't talking and I was, I mean, we were really
Probably,
yeah.
quiet, no lights and all that. I might be able to, but I can feel a little sticky though when she ran over here. I could feel it initially.
And so what I love about this is that it's not just with the lymphatic system that we're working on. I mean, we'll actually be able to clear some organs as we're doing this. You can feel it over the pancreas, the liver, the stomach,
Yeah, people.
ovaries.
Yeah, they think the lymphatic system is, many people. I'll tell you, the lymphatic system. That not many people even know what it is, and that's okay. And that's, where my passion is, and just intrigued by it. And then to learn that my first passion, learning about the gut, is now really closely tied to the lymphatic system. There's so much in the gut in the lymphatic system, and that's probably the beauty of if anyone's heard, in doing manual lymphatic therapy, that was created 100 years ago.
Right. And manual is very important.
But it doesn't reach the gut. It does not reach the gut entirely like this does, and that's where the founders of this really excelled, and found that this device excelled.
Yeah.
And,
And it really is a great partnership, I think, to do your deep and then continue with your superficial, which is what we call pretty much the lymphatic system that's close to the surface, and that's your day-to-day stressors, and so getting a manual is really important to move that.
Yeah, and I do. I mean, I have manual lymphatic therapists that come see me for this. There are clients who are receiving manual lymphatic therapy. It's not to put one better than another. There are two different techniques, although I will tell you that this is the most effective way to move the deep lymphatic system as well as superficial. Knowing that your superficial lymphatic system is about 70% of it, it's a great deal. But when we're looking to really work the immune system as a whole body approach, there is nothing more effective than this.
Wow. It's fascinating to me.
Yeah.
And it feels great.
And we talked about stories before, but sometimes lymph nodes, their job is to help fight off infection. They can get congested and swollen. We know the doctor feeling our neck, right?
Yes.
Ooh, you have an
Yes.
infection up there. Sometimes they get stuck. I've seen some up in this area right in here, the size of a green olive, and when this is applied to it, it just. Boop,
I have a
disappear.
patient right now.
Yeah.
He's in his 70s. I think I believe he is. But every time I feel his thyroid,
The abdomen now.
he has these huge lymph nodes, submandibular, so underneath, the jaw.
We're gonna
And
get to that.
Every time I feel that, I go, oh, it shocks me. And I saw him 2 weeks ago. He goes, remember, those are my lymph nodes. He's had them forever.
Okay.
I wonder if it would help at all. He's in his 70s, and but they don't bother him. He's had them looked at. He's had them ultrasounded, and all that. It's not, cancer. They're just really large.
Yeah, they're probably congested and
Yeah.
So how would you feel? What can I expect, or people after this? Tomorrow, the next day, do you feel anything? Does it ramp up your immune system? What does it do? Like, should I feel anything?
You can feel some effects from detox. I can tell you, there needs to be a lot of water. 48 hours of
Like a massage,
water,
if you got a massage, okay.
You are going to be detoxing, like a massage. But I tell you what, most of the clients are saying, hey, I feel lighter. I just don't know what it is. And I didn't make up that adjective of how they feel, but it comes back.
And we don't really know what that means, but I can only assume you're moving fluid. Fluid's heavy, so I would say that the lighter could come from that, but I don't know because I don't experience that. So I love hearing what other people experience because and I'm a little jealous of it, quite frankly.
And we talked about lymphatic drainage. It's like
Right.
I know the funniest question. Last year I started with Victoria last year, and just love it here. the funniest question is, where does it go?
Yeah. Yeah,
I
where
know,
does it go,
I know.
right?
So it does. It's moving. We're moving it throughout your body, and it's doing its job. We're assisting your lymphatic system, and it does. It comes out in your urine and sweat. So the things I tell my clients: replace the minerals, from detoxing in 48 hours. Drink lots of water. Keep moving.
Would it help
don't get
to
on a
sit in a
6-hour
sauna or
flight.
no?
And the next thing, if you can sweat, bonus.
Okay, that's, yeah.
Bonus. Yeah, we should all be sweating.
So tomorrow after work, I should sit in the sauna.
Yes.
And-
Yeah.
Okay.
Yeah.
Okay. Did you say 600 lymph nodes?
500 to 600 in the average human body is about and then I named like 25 underneath the arms. That's a regional area.
I
And
need
the
to
neck,
learn how many we
15,
have
Yeah.
in the abdomen area because, the gut, I mean, it's connected to everything, people. I mean, it's a direct correlation,
Yes.
the gut-the-brain connection, the gut-the-brain,
Yeah.
gut-brain axis, it is 70 to 80% of your immune system.
Mhm.
So all of my patients who have gut issues, they come in, with just unbelievable issues with the gut. And me, with 20-something years of IBS, if I'd have had something like this with a good, healthy diet, right, and moving your body and sleeping and all the things you have to do, it would have just been a different story probably for me. There might not have been lupus involved.
I'm going to move this to the other side, and we work. It's the inguinals or the bikini line, and this wand will actually rest right there when I finish the rest of her abdomen, and helps open up the nodes or stimulate them, so that when we sweep and push the legs, it'll go right into the nodes there. They'll be ready to receive that. And then from there it goes down to the deep lymphatic system, cisternochyli, and a lot of technical terms that I stimulated already right here in the abdomen, and I'll later lay the wand there as well. So everything is going to flow together harmoniously. It's a beautiful thing. The more and more we study about the human body, this amazing it is. And then it'll flow back and mix in with the heart and the blood. So.
If anybody wants to see something fascinating, there is a video on YouTube, and it's called Strolling Under the Skin, and I think I'm right about that. But it is absolutely fascinating. They took cameras and they actually went under the skin and through the lymphatic system and also through some of the your capillaries, your veins, but through the lymphatic system, and it is just fascinating. So you should look for that on YouTube. It's called Strolling Under the Skin.
We can put that link up
Okay.
on here. Wow.
Yeah, and so Dani's liver feels amazing.
Wow. I
A
just
lot
finished.
of times, and when I said sticky, I meant like the wand will actually stick to your skin, and it'll drag over it. And what I'm able to do is stimulate that and help sweep that lymph to where it goes
Wow.
in certain directions.
Kimberly asked, how long after a breast implant removal is it safe to do this?
Oh, wow. Good question. That's a
She's
hot
had
topic.
hers removed for 9 weeks now.
It's a
Okay.
good time. It's a
I
very
would
good,
think that.
yeah.
Yeah, I don't know that answer, but Victoria and Jill would.
Right. So I say pretty much immediately when you are no longer a bleed risk.
Okay.
So once the tubes have come out, once you start to heal, and the other beauty of the lymphatics is that it will also help with scar tissue. So it will help to soften up that scar tissue.
And now is where I laid the wand here in the inguinals or the bikini line. There's actually like a T set of lymph nodes here. And those are roughly about 15 in here. These are regional. They do a lot of work. With my male and female patients. Male patients, there's extra movement here, extra swiping and sweeping and opening in this area.
Really?
Yeah. So there's a little bit of drag with the wand here. I'm having to work a little bit more.
Huh.
Yeah.
Well, I took a cycle class yesterday.
Okay.
I have taken one class in 20 years, a spin class. Hated the class 20 years ago. I wasn't thrilled to death yesterday, but I did it for the American Foundation for Suicide Prevention.
Nice.
My legs are so sore, I can't even hardly go. Oh my gosh. It was a ton of fun, but man, that was hard work. I admire anybody who does a spin class multiple times a week.
I do too.
So Leslie wants to know if you can recommend anyone in Memphis that can do this.
Oh.
We can look it up on the training site. Sure.
Yeah, we can
we'd love
find
to.
her. We'll
Yeah.
find you a provider that is close there. I don't know if it's going to be exactly in Memphis, you said, or Knoxville?
Memphis.
Memphis, but we'll try to find you somebody as close as we can.
Yeah.
And you can always make a weekend trip to Nashville and see Victoria. Or, well, you don't work on the weekend. Do y'all work on the weekends?
We're not.
No.
Not set up this weekend.
No.
Yeah.
Yeah.
We have, and we'll be looking at that in scheduling, I guess.
Yeah.
Yeah. There are lymph nodes at the tops of the feet here.
Really?
While we were talking, yeah. So I opened up the inguinal nodes in that bikini line there, and I'm stimulating the lymph area right here on the top of the feet. Also down here on the inside of the ankle. And then the vessels will travel up the leg and they will empty into that inguinal area.
So Melissa wants to know how she can get certified to do this.
Oh.
Ask her to call us. We can help her with that. Just have her give us a call during the week.
Okay.
Yeah.
Move to the other side.
Victoria, what a great compliment this is to your thermography.
This is an
What you do.
amazing compliment to the thermography, and it's a hula hoop. I mean, we do three things here again because it's a triangulation, and it is so amazing to be able to do the thermography and sit down and let Jill look at everything, and we sit down and come up with a care plan before we even see you, because we know where you're congested. We don't even, it's not even a guessing game for us if we've had the thermography first. So it has been a wonderful compliment.
Oh, I didn't even think of that. That's
Yeah.
perfect.
Yeah.
And again, it's nice to offer that solution, right? When we see that, because there are many things that it takes to help heal the body, right, Dani? It's not one
Oh
thing.
my goodness, it's not one thing.
But,
I mean,
yeah.
you can clean, these people oftentimes, come in with just boxes and boxes of supplements.
Sure.
And I tell patients every day, you can't out-supplement an inflammatory diet. Can't do it, right? It takes, you need a couple of supplements, not substitutes, right? You have to eat well, you have to sleep well, you have to move well, poop well, you have to decrease stress, you have to have community. It's emotional, physical, spiritual, mental, sexual. It's the whole thing. It's not just one thing,
Yes.
ever.
Yes.
So Kristen has asked, and I'm going to butcher this because I always do every time somebody brings it to me, if it's good for someone who has you're going to have to correct me.
Ankylosing
Yes.
spondylitis.
Yes.
Yes.
And the answer is yes.
Yes, because that's an inflammatory condition.
Correct.
Right? So anything that ends in itis, I would think it would would help beautifully with.
We
Absolutely.
won't need your scarf anymore.
Oh.
Can I take that?
Okay.
Yes, I trust you.
Are you
Yeah.
gonna spin over?
So I'm going to have her turn over. So you can stay there with that. Yeah.
Okay.
And then take your time, and we'll make your way
Yeah.
up to the headrest. No, you're good.
Okay.
Yeah.
So some of the other things that are interesting is, especially for people who have had surgeries, a lot of times, especially women who have had hysterectomies, abdominoplasty, and you get that little tiny pooch on your tummy, and you don't know where that's come from. It's just that little tiny low pooch, usually around your scar. What that is sometimes is lymphatic fluid that's starting to accumulate there. We disrupt the lymphatic system. A lot of times it just gets cut through because doctors don't really realize that they're actually cutting through it, and so that fluid doesn't drain like it should.
Oh, wow.
Yeah.
So what we can do in very special cases is we can actually reroute that, and we will get the lymphatic system flowing the way that it is supposed to again.
Wow.
Yeah, the body is really amazing when we start to study the deeper levels of training in this therapy. The body tries to reroute lymph across the chest, and it's called an anastomosis. And sometimes it is successful in that, and other times not so much. And this can actually help open that up It's a little different technique, but the body is truly amazing.
So Linda is asking what the cost is. So the cost is $125. It's a 1 hour treatment. It's the best 1 hour timeout you'll ever give yourself.
Yeah. I mean, I explain it as not like a super deep relaxing massage, but I have a lot of clients that just, that actually like it better. Some of them do say that.
So Ava has a very interesting question. She says, how quickly do you see results that she has had a few treatments and hasn't noticed any changes? Well, unfortunately, I don't know what we were working on. I don't know exactly how congested you were. I don't know why we were doing this. And whether you've seen changes or not, physically sometimes you don't see the change.
That's right.
You see it in other things. You see it in your digestion. You see it where everyone in the house gets the flu for 10 days and yours is for 4. I mean, we're going to get sick no matter what, but this certainly does, because it's enhancing your immune system. It's going to help you be able to push that through your system faster.
Yeah. And lately we've had when you do thermography, it's not required, obviously, to do this. We can help you move the lymph, and I can feel the congestion with this if that's not something you choose to do. But we have had some that come in and do the thermography and then have the treatments here. We do recommend, a lot of times we'll recommend 4 treatments.
Okay, yeah, that was going to be my next question. How many?
4 treatments to get started.
In
if
a
we're
week?
just
I mean, in 4
in 90
weeks,
days,
Oh, 90 days,
So
okay.
4 treatments in 90 days. That looks like this one, and then we would come back in a week and a half to 2 weeks, and then a month and a month. And that just kind of helps the body kind of like stimulate, break up congestion, and get you on the right path. And then many clients come in twice a year. If I'm working on something more specifically, I have clients that come in once a week, and some that have been in twice a week on a particular regimen. So, not harmful to your
Right,
body
but the average
anyway.
person would not need,
Yeah.
I mean, because you'd have to have something going on to do that twice a week. I mean, that you had something medically, wow, we need to get this fixed.
And then to answer and having, not feeling anything. So there is that, sometimes we don't feel like what we want to feel after, or we don't feel lighter, or, but we have seen in thermography images of the women have done before treatments, and their thermography images are clear.
Yeah, I can't
And it's
wait
really neat
to do that.
to see that too.
Yeah, that change is always fun to be able to see.
I saw that in myself, just personally too. I did 4 years of mammography and 8 years of thermography for breast exams, and at that point I had learned about lymphatic therapy, and I've just seen the changes. So it's
So Krista asks, are lipomas a result of lymph getting stuck?
Oh.
it's a good question.
Well, okay, so I'll speak a little to that.
Okay.
On the lipoma side, okay.
So you can come
It's
up
a-
here. We're going to work on the back.
It's a fatty tumor. That's what a lipoma is a fatty tumor. So it's usually fat. So I don't know, Victoria, I don't know that answer. I wouldn't think so, but I don't know.
Yeah, it is not.
Okay.
But what's interesting is that the lymphatic treatment will, I don't know if dissolve is the right word,
It breaks up.
but it breaks up the lipomas that we find. And we have a lot of people who had chronic lipomas that had them on their arms or had them on their back.
Yep,
And
that's the 2 big places.
Right, and then
Yeah.
after doing a couple of treatments, all of a sudden they're like, oh my gosh, that was, it was always there when I snapped my bra and it's not there anymore.
What?
Or getting smaller.
Or getting
and-
smaller, right.
And the treatments are going to vary. I mean, maybe we could take all 4 for that too, depending,
Sure.
depending on size and consistency and how long it's been there.
How long it's been there.
Yeah, and again, we don't know what you're doing outside of this,
That's
right,
right.
Dani?
That's right.
And we just
And-
try to encourage you as much as we can, but yeah.
And speaking to that, not having had therapy and not seeing any difference, I tell patients this. I have patients sometimes you say, Dani, I did the 10-day detox and I don't feel any differently at all. I'm like, well, I'm going to tell you right now, you are different. If you actually did the 10-day detox the way it's supposed to be done, you are healing from the inside out. Now, you may not, it's rare for people to say they don't.
Sticky here.
What is that? Oh, that's my lip. Well, my.
I didn't want to
my-
interrupt you. Yeah, your kidneys.
Yeah, my kidneys
So a
are
little
back there.
dehydration here. Really.
Yeah, I am
those kidneys,
dehydrated
yeah.
today. I can tell you I am.
Yeah, yeah, and that is going to be your friend, right? Because again,
Yep.
the lymph is going to move. All of my clients, we'll get up right off our table, right, and go right to the restroom, and that's
Oh,
a beautiful
wow.
thing. Yeah. So we need you to stay hydrated
Okay.
after, 48
Okay.
hours. It's really going to benefit you the most.
Yeah, I do a much better job staying hydrated at work than I do at home on the weekends. Because I have a huge 64-ounce jug, which is about what I need to drink every day. A little bit more than that because I do have coffee. And I'll drink that at work. But then on the weekends, I don't bring it home. And yeah, so I believe I'm dehydrated right now. So anyway, if you didn't feel something, I know it's working because I know it works. Everything you do, everything I do in the office, from literally the inside out.
And yeah, you're right.
Yeah, and if it's helping your immune system, you may not realize it worked until you aren't the one who gets the flu, or you get, like she said, a lesser case of the flu, or your allergies are better.
Yeah.
In the spring, I hear people tell me that all the time. Dani, I just didn't realize it, but this season I didn't have allergies so badly.
Yeah.
Well, I can tell you that one of the two of the things that we find are the people who have wake up in the morning and you have to clear your throat for 20 minutes, or have the allergies, whether they're seasonal, and sometimes even if some of the foods get better. But once we clear the lymphatic system, those symptoms start to get better.
Wow.
Yeah, we just heard a big ah.
Oh,
right
that
now.
feels good. Yeah.
So this is where a lot of your muscles are going to attach to the back of the head like that. It feels really good. But this is the occipital nodes back here. So we have a couple nodes on either side.
Oh, it'll be interesting because I go every Monday afternoon to Dr. Deering, and I get adjusted now. And it's my neck. My neck doesn't move.
I remember you saying that
It
on the
does
last.
not move. It'll be interesting tomorrow to see if he can feel anything differently, or if actually it'll move on me.
So Angela asks if haven't any patients reported feeling nauseated after doing the detox and then doing this.
Okay.
I have not had.
I
any
have not
patients
had
with
anyone do
nausea.
that. Right. With or without a detox, I haven't had anybody.
And safe. Obviously, if you're pregnant or nursing, we're not going to flush toxins to the baby.
Right, right.
Contradiction, pacemakers, frequency also.
Oh yeah, no
Yeah,
pacemaker.
yeah.
Yeah. So who are the pregnant patients, nursing patients, pacemakers? Anybody else? I mean, what if they're on chemotherapy? Do we do?
Yes.
We do.
No.
We just don't do it for 2 days before or 2 days after.
Okay.
So we want to let that chemo get in there, do its job,
Okay.
and then we want to help start flushing out so that it can work even faster.
Okay.
And the studies are from the doctors that you're once again adding natural modalities, therapies to support the body while you choose whatever path that you're going to choose for the cancer. But adding this to support the body makes those other therapies less painful, less having less effects, negative effects. Actually, more positive effects too are some of the studies. So again, you're supporting the immune system. You're touching every part of the immune system, the lymphatic system. It's a whole body approach. We mentioned nodes, vessels, trunks and things like that. But part of the organs of the immune system is the spleen. We stimulated that area. Your thymus gland in the middle of your chest is part of your lymphatic system.
Yes.
Sending out T cells. We are stimulating your nodes and they are sending out more T cells to fight off infection. So if you are congested And Americans, we are all congested. Your immune system is compromised to one degree or another. That's kind of like just simply put, right?
Yeah, and that pretty much goes for everybody, even Dani.
Even Dani.
Even Dani. And Dani does everything that she's supposed to do, and she is not hasn't escaped it yet either.
No, I mean, I'm pretty good. I'm not perfect, but I do. Yeah.
And I'm feeling some lymphatic congestion up in the
Right
upper
here.
neck area like that.
Which we saw on thermography, by the way.
Yep,
Yeah.
we did.
And I could feel it move. I could feel the body respond to that, from my touch. So we're gonna turn back over when you're ready. Take your time. Come back down on the bed.
So I've been trying to think of some other, we have several clients who are lymphedema patients who have undergone mastectomies. They've had other surgeries that have left them with a lot of edema. We've had cellulitis clients that have come in. And
What about cellulite patients?
Well,
Would it work? Will it break up?
Yes.
it will. We actually use grapefruit oil with
What?
it.
Yes.
And there's something in the properties of the grapefruit oil that works with the frequency and the equipment, and it will break up your cellulite.
All right, I'll be back next week.
All your citrus
you
oils,
can
right?
be really thin, and I am. I'm not a big person. I've never been a big person, but you can have cellulite. I can tell you that. I was horrified the other day in the mirror. I was doing a down dog. Don't ask. But anyway, I looked in the mirror. Oh my gosh! I was like, well, that's new. Yeah, not good. Saggy and cellulite. Oh.
Through a lot of my training, we actually work with some doctors or cosmetic, and what I'm about to do under here, there are many, many things that we can do cosmetically, and I'm not trained for that, but it helps with sagging and breaking up fats and proteins and things under the chin.
Oh, under the
the
chin. I was going
mouth,
to say, what about this little
everywhere.
English bulldog look I've got going on right there that could stand a little tightening?
We never use it as a cosmetic device, but there are side effects for that. So here's a nice little bit of peppermint to enjoy.
That smells good.
Linda said your skin looks amazing, Dani.
Oh, thank you. I appreciate that, but I it's a little bit saggy. I feel like Harlan, my bulldog. If I could just pull it back a little bit. Isn't it funny how we're never happy? I mean, I'm happy. I'm just irritated that it's drooping down.
You'd be happy. Yeah.
It's part of aging.
So this is most enjoyable. We've gone through this a little quicker than usual, obviously, but we'll finish up on the head area, and we'll be working starting under here, under the mandibular, and opening up nodes under here, and opening up the node group of nodes over here, mastoids, parotids, everything, opening those up to drain down into the clavicular area. And then we'll move up near the sinuses, retrophageal, lymphatic up here. Not to get too technical, but all of that has to be open down here before all of this will move down. And then we'll work closely into your sinus area right here.
Oh, wow.
We'll pull this down here, you can see, and then down.
Well, in Middle Tennessee, with so many allergies that we have, you would think this would be phenomenal.
It really is. I have some younger clients too that have been just congested for years. I had one man in here, and his wife was here. Obviously, a lot of the wives bring their husbands, which is great. And he's like, I could breathe. And I was like, oh, that's great. And we started talking, and he got up again. He's like, no, you don't understand. I haven't been able to breathe in like a year.
Wow.
So we are breaking up that congestion. Or, if you've got a really bad sinus infection or something like that you're recovering from, and you just want just a one time, to get it out, get it moving so it doesn't get clogged up and congested.
So Linda and Missy say that they both need to do this.
Yes,
Wonderful.
they do.
Yes, they do.
Well, I'm going to tell you, this is not your normal one because you wouldn't be speaking and all that. I think it feels amazing. And I haven't even been able to relax. I mean, much because I've been listening. I think it feels really good. I'm surprised. I had no idea.
I do have some clients that liken it to it's a medical European med spa treatment. So they go get their facials and, you know.
Linda asks if you treat men.
Oh, yes, for sure.
What'd she ask?
If you
If we treat men.
Oh, men.
Mm-hmm.
Is it something that insurance covers? Missy wants to know.
Yes. So obviously we don't do insurance. So we always want to be upfront with everybody that we don't do insurance. But we will give you what you need. And this is considered to be, is it the laser? Is that what it's billed under? It's considered to be a laser treatment. And so if your insurance covers that, then yes, you will get reimbursed.
I
For that.
wonder if your health savings account will pay for this.
HSAs and FSAs both cover this.
They
this
do.
treatment. Yes.
Oh, wow. I love my HSA. I have an HSA. And many people don't realize, you can pay for your supplements with an HSA in a provider's office, not like at Target or Walmart or whatever, but in your provider's office. So I had no idea. So an HSA and FSA, because FSAs are a little tricky sometimes. So I didn't know that. That's great.
Yeah, or let me just, and I'll have my disclosure is we haven't had anyone come back and say that they were not covered. We can run the cards here, and I don't have anyone who has been kicked back
Okay.
On the
So,
FSA.
on the FSA.
Okay,
Yeah.
that's great.
Yeah, insurance companies and natural health are very questionable.
Yeah, well, the
They're
best
not
thing
friends.
I have a really high deductible insurance plan, and the best thing I've ever done for years is have a HSA involved with it, and I do max it out. I fill it up with the most it'll let me do, because I don't ever go to the doctor. I do things like this. I mean, I have a primary care doctor, which I highly recommend everyone have one, but I see her once a year.
So Missy says she's calling us tomorrow.
Oh, good. Well, give them a phone call. Tell them Dani sent you.
And it is
Going over your thyroid here
just
too.
while we're on that subject, and Dani's getting more relaxed. So
We're working on her thyroid area.
Oh,
Parathyroid goes.
that's what you all are watching, is that Jill is working on Dani's thyroid, and of course that's Dani's big thing.
That's right. We got to keep
She's
that working.
She's the queen of thyroids.
So now we're going to move up near the eyes. The sinuses here. And we just kind of just pull all that down.
I want to tell you, I think this feels amazing.
You really can relax quite a bit more without the clinical fluorescent lighting on you.
Right.
I promise. There's never any judgment here, never anything, boy. It's just time for you to get better and love yourself, boy. This is about taking care of yourself. There's so many things, vying for our money for natural health, and
Trinket says
That's a
that
good thing.
Jill is awesome, and Melanie Cooper says that it is her favorite.
Oh, Melanie, I just love you.
Yeah.
Well, I know that we do crazy things and cockamamie things on Sunday nights and all, but I just felt like people needed to know. Well, I did too, because how many times have I canceled? I've had appointment, had to cancel. Oh, and I
was
just
gonna come looking for you when
Yeah.
I heard you did your detox. I was like, all right, you're coming in.
And I just feel like there are so many people like you all out there who offer unbelievable things for people. And oftentimes people don't know. And it takes a village to get the word out.
Exactly.
And, one person at a time, if you can help one person, then you've done something great. And so I just appreciate y'all being here on a Sunday night
Of course.
to do this.
Well, we appreciate you doing it, and we love your clients. I mean, this is a village. I mean, you always talk about a village, and
Yep.
everybody talks about a village, and it is a village. And unfortunately, there's not a lot of us villagers around, and so when we can pair together and be able to share our information and our technology, that's going to help everybody. It's just a win-win for anybody.
That's exactly right. And I think that we need to support each other. We need to lift each other up. There's enough of the pie to go around for everybody. And I've never understood like trying to just keep your people all to yourself or your knowledge all to yourself. I don't understand that. I've got a lot of issues in my life, but not sharing education is not one of them.
Right.
I just think that we have to share what we know. And when you know better, you have to do better. And you have to lift up other people. J.J. Virgin says a rising tide lifts all boats, and it's a fact.
Yes.
And it takes a village to keep it going. And there's no room for bad comments. There's no room for negativity. You know, if this isn't your thing, well, then turn off the Facebook. Don't watch it. Who cares? You know? I mean, you have to, again, a rising tide lifts all boats. And when you're going up, when you're having great success and you're helping people, you know, I just believe you have to reach out and support other people.
Totally agree.
And that's what we're about. We are about support.
That's right.
So Dani, how did this feel?
Oh, well, that's my whole favorite up here.
I
mean,
do a little
this
extra
is
here because I know it feels so good, and you deserve that. Everybody deserves.
When I get a massage, which is not nearly as often as I'm supposed to or would love, I have them pull my hair. I love it. Just, yes. And so I like anything to have to do with the neck up.
It's a nice little stimulation of the sinus nerve. In case you have sinus headaches or anything going on, this really, really helps.
We're being quiet through that, Dani, because it feels so good. I didn't want to interrupt that.
It does. It feels amazing.
It does. Yeah. So basically, what Jill was doing was she actually took the wand and you can put it basically right there. I call it number 11s, right above your eyebrows, and just kind of a little bit of pressure and pull it all the way back to the crown of your head. You can do that to your pets. You can do it to your children. You can do it to yourself. And it just feels amazing.
You know, that question about doing this after breast implant removal.
Yeah,
oh, my
there's
word.
so much we need to talk about, right?
That's a whole show. And well, we don't have a show really, but that's a whole Facebook Live in itself.
Yeah.
Yeah.
And I have many clients, mastectomies, explants, implants.
Implants and then explants.
Yeah.
Implants and then explants. That's right.
That too, yeah.
So how long is a session typically?
60 minutes, yeah.
Okay.
Yeah, which we're close to it. I was even going to say, you know, just pay attention to that lymphatic system with all that you're doing. It just totally makes sense. It's not out there. It's not a very common thing, but in 2012, University of Southern Cal said the lymphatic system, in comparing to the circulatory system, is essential. It is essential for human health, and it's just so overlooked, which we all know many things are overlooked in our health system, but 2015, they're talking about the linked indirectly to the central nervous system. So there is lymph tissue in the brain itself. It's indirect for this, but on top is lymphatic, which helps with cleansing and sleeping. And but the studies just keep coming out more and more, and it will. Yeah. So.
Well, that's what I love about Victoria and Jill in this whole place. I'm going to make sure
Then we
here.
should finish with
Yeah,
some nice
Ella,
fresh
that was
oil
very
and-
smart moving over there as I moved up. Thank you very much. What they are ahead of the game, right? I mean, they're ahead of the game, and this is not your standard run-of-the-mill treatment. It takes an innovator, right?
Yes.
To bring something like this into their office, and I'm grateful.
Yeah.
I thank you.
And I'm so passionate
I feel
about
good.
it. It works. It does. I wouldn't do it I've had 15, 20 years in the healthcare field, and I could choose anything, to do it.
Right.
But this is, this is my heart. This is my place. This is where we treat you like this is about you. No judgment, no nothing. You just come and get better and feel good. So
And I don't feel nauseated. But you know, I can see where possibly because you stimulate things, and if you were on the verge maybe of getting sick anyway, like before when that one time that happened to me with thermography, maybe. But you know, I feel fine.
but remember,
hopefully.
lymphatic fluid is going to send out more T cells. It's going to get it flowing.
Well, my thought
and
is,
antigens will
if
help
you
come in.
are really stuck and not
Yeah.
moving at all,
Yeah.
and you get this moving, maybe you would. I mean, maybe you could
Right.
have a little bit of nausea,
Sure.
feel
Sure.
achy and things like that.
Absolutely.
Sure, because it's moving,
That's right.
right? When you get unstuck.
Yeah.
All right, guys. All right, are we finished?
Yeah,
with
any
what-
questions,
so
feel
any-
free to call the office and I'll be glad to answer them. I'll be at your events, so I will
Okay,
be there
Friday
too.
night,
We'll be
they
there.
will both be at the Hashimoto's Christmas party, 6:30, Friday night at the office. If you refuse to cook or you won't show up because you don't want to bring a potluck, oh, for crying out loud, don't bring the potluck, just show up. There's going to be plenty of food there. I'm going to make a big O salad, one of her kale salads, and anyway, and then Allen Hill Pharmacy always supplies the wine, and they'll have some boar's head meat as well, but it's going to be a ton of fun.
Yeah.
So they will be there to answer questions.
Yes, for sure.
Okay, and I
And
appreciate
there are a
it.
ton. There are so many more, and I'm sorry we didn't cover all of them or answer all the questions.
Oh, I
tonight,
thought you
but
all
we
did
will.
fantastic.
Well,
Yeah.
no, Ella did.
Ella,
fantastic.
thank you.
Ella,
Ella
thank
Kate,
you.
I love you. She's so good. She's a behind the scenes kind of gal, and you know, I appreciate you. Thank you, Ella, for doing this. But their phone number's up there. Give them a call. You can also go to the website, which is Victoria Bailey
Health and Wellness.
healthandwellness.com.
Yeah.
Kim
Okay.
says that this looks awesome.
Yay.
Well, it was awesome, and I can't imagine how great it actually is if you be quiet and you don't have cameras and all
Yeah,
that.
a few more oils.
So
and-
I'm looking forward
You're right.
to
You're right.
to doing it again and doing it the right way,
For real.
right? But I can't wait to redo my thermography.
Mhm.
Do my thermography and see how it goes. All right, guys, have a great night. Thank you for
Bye.
putting
Thank
up with us
you.
and our crazy ideas that we have. We appreciate you. Make sure you get some sleep tonight, all right? Meal prep, get everything ready for tomorrow. Don't be all crazy tomorrow morning, right? Right? However
Never do
you
that.
wake up.
Yeah.
However you wake up and fly out the door is how your day's gonna go. So get prepared tonight. We appreciate you. Oh, next Sunday night is Dr. Dennis Goodman, cardiologist from New York City, and we're gonna be talking
Nice.
vitamin K
All right.
and all kinds of things. So I'm excited. You all loved Dr. Goodman, so when he was on before, so he's gonna be next Sunday night. So make sure
Yeah.
you have your Facebook on.
Yeah.
We'll see you later, guys.
Bye.
Thank you.
Have a great
Bye.
week.